Well, Don can walk into a room and instantly connect with people and explain what he's doing and get them interested in why he's doing it. Whether that's at an AAE meeting or inviting friends over for dinner, he has a great way of getting people engaged.
He's just very passionate about what he does, to the point where sometimes you have to kind of maybe step in and go, Don, can you come back to focus, please?
Don has an intensity about him and sort of a single-mindedness that's probably more effective than interpersonal skills in getting at these kinds of problems.
My husband and I went out to dinner with him one night. This was after the AAE convention in Boston, and he started to tell us about the MRI technology that he had heard about and was starting to look into. My husband and I looked at each other and we just kind of smiled and we just let him talk, and then afterwards my husband and I said, "Do you understand anything that he even talked about?" I said no, but he was having so much fun talking about it that we didn't have the heart to make him stop.
I've gotten to know Don quite a bit over the years and what he does and what his interests are. And I've been very impressed with his insights and his dedication and his overall work ethic.
What makes him really good at teaching clinical care and research is not only his abundance of knowledge, but his extremely good professionalism and ethics.
He always teaches us to think critically, to think diagnostically, to look beyond the tooth and beyond the patient's complaint of pain, but see a person.
Pain is not only a physiologic but a psychological feeling, and so he really listens well to what the patients are saying, and then he takes that information and is able to make some clinical correlations or make some clinical judgments and do some testing to kind of confirm or deny what he thinks is going on.
The interaction with endodontics has been perfect for him because he really has focused on non-surgical root canal treatment, what we can do with these patients to better inform them about what they can expect, and then ultimately how we can intervene so that they don't have as much pain afterwards.
Don has done a really nice job of engaging the endodontists, the AAE, in that process so that they have really been a true partner with the Practice-Based Research Network to make that happen.
He surrounds himself with really intelligent people, hardworking, provides them with an environment that's going to bring out the best in them and let them do their thing, and it's a win-win for everyone.
He likes community, he likes people, and he wants to create a sense of family.
Don is really hardworking and I don't know how he actually does such an amazing job at balancing his role at the University of Minnesota as an educator and actually taking over that department there, and then his role as a scientist in this really important research that he's doing, and then also as a family man, and it's a lot to juggle, and he seems to do it effortlessly.
His perspective, his patient-centered care, his research, and his creative leadership, they have all shaped me and helped me become a better clinician and a better researcher, and that's what I would like. I would like to follow his steps.
Don is influencing the endodontic profession because he is bringing forth research that is big national studies, observational studies that are not possible or have not been done in endodontics looking at these topics in the past. So the scale, the opportunities to take advantage of NIH, NIDCR funding to do these big studies in diverse practices with diverse patients is really a major contribution to endodontics.
Don works hard and really doesn't ask for a lot of praise. And that's why I think it's just absolutely wonderful that he's getting this award.
Dr. Nixdorf, congratulations on this great award. You deserve it, and I'm really proud of you.
Don, I'd like to pass on the congratulations of the whole School of Dentistry on this very special day for you. Thanks.
Thank you very much for this prestigious honor. I'm humbled to even be considered for the AAE's honorary membership, especially given the people who have received it in the past. I've found that success is based on teamwork, and I'm so fortunate to have excellent teams that work with me. The most important team is the one at home. And I'd like to thank my wife Lisa and children Ian and William. Without their continuous love and support, none of this would be possible. There's the team at the University of Minnesota School of Dentistry, and I'm blessed to work with such talented and committed individuals. That includes the staff, students, and faculty colleagues. Most notably, I would like to thank my mentor, Eric Schiffman, for all his guidance and leadership, as well as his selfless gifts of knowledge and expertise that have been so valuable. There's a team at Health Partners under the leadership of Brad Rendell and the Oral Health Research Group that has been such a joy to work with. And then there's a team of very talented and passionate endodontists that I've had the privilege of knowing and working with over the years. Specifically, I would like to thank Donna Matchcheck and Alan Law for their friendship, humor, and honesty. Never a dull moment with those two. Thanks again, AAE, for this recognition.